Hello, my name is Shane Pavlovic. I'm the CIO of Niagara Health. Before we launch into today's discussion, I want to thank IdentityNORTH for having us here to share an important initiative that is underway for the province of Ontario. Next. For the first bit of our talk, I was asked to share a bit more about the genesis on how we at Niagara Health arrived here and our role in the provincial initiative for a connected health system. For those who might not be familiar with Niagara Health Navigator, it's much more than a mobile app. It is a heartbeat of the connected digital health journey that we have envisioned for some time, for our patients to be able to receive the best possible coordinated care. Not only does it help patients receive crucial information personalized to them in a timely manner, it's a point of discovery and convenience for a broad range of supporting virtual health services supported by access and control of personal health data. A very important aspect is the capability that it offers patients to easily set up an account that leverages a trusted identity. This is a truly unique feature in that it allows patients to securely log in using a trusted provider and consent to sharing their health information services and practitioners in a way that is totally privacy respecting. We are very proud that this solution is being introduced by Niagara Health for the benefit of the community and beyond now in the provincial IAA project. So where did it all begin? About a year ago, we realized there was an opportunity to create a more patient-centered experience, which would help reduce points of friction, such as wait times, and offer more seamless and supportive transition for patients throughout the course of their treatment and care. We understood that a patient's journey at our hospitals could sometimes necessitate a range of different treatments and practitioner visits, and we wanted to make this work better. Our focus and ambition was clear: create a patient-centered health experience that fostered greater convenience and control while respecting privacy. This said, we also knew very early on that we didn't want a one-of health app that would be forgotten because it was too difficult to integrate with partners and other health services. We needed and wanted everyone to win. Next slide. From a technical standpoint, this was going to need the setup of a digital health ecosystem, one that was trustworthy, could allow for health services to be easily added, and for access to personal data across these services to be secure and available on demand. The trouble was, we have multiple data warehouses and departments that are supported on different systems in various silos. To add more complexity, we also didn't have a place for anyone's digital identity. I have to say, if it wasn't for the innovative access control technology and shared resolve to help patients by Dentos, we might have still been waiting to find the right technical solution. In our discussions with Dentos, it became apparent quickly, mobility, trusted digital identity, and a new approach to access control would help play a key role in creating a digital health ecosystem that would help us get started and continue to scale. Together, we invited discussions with a number of new partners, including Security, to help refine our solution. And throughout evaluation and deliberation, we arrived at a solution which we call the Niagara Health Navigator. By leveraging their software and experience, Niagara Health can enable patients in creating an account by using a framework for digital identity that achieves a high level of assurance and trust. Since many of the systems that hold patient information do not have the capability to match with a user's identity, we had to innovate and enable this vital piece of the puzzle for the benefit of patient and services for consented data sharing. The Niagara Health Navigator allows patients to conveniently coordinate their health experience without having to physically be present at a hospital. At the same time, the Niagara Health Navigator program represents an opportunity for more partners in our health communities to offer the possibility of shared services that, again, are to the benefit of patients. Throughout the last year, we made great strides launching the Navigator, and helping build value for patients in our community. We initially started the program with the releases of the Navigator mobile app, offering patients simple services and information to help in preparation for hospital visits. As we began to receive positive feedback, we started to build a roadmap towards the identity-related services. Next slide. In the last few months, the health crisis has really thrown everyone for a loop. With COVID-19, we are one of the more privileged to have our Navigator available to citizens. But we wanted to support the community and health authorities with tools we had in hand more broadly. While we've been able to very quickly adapt and provide timely information updates to patients and citizens via the Navigator, without collective intelligence more broadly, we are still at risk. We have benefited from the leadership of the Ministry of Health and a number of our partners in the community in helping chart a new course that would underscore our ongoing efforts for a provincial health system. We realized that we needed to help empower our virtual health service partners with more rapidly and offer a platform to reach patients in a timely and secure manner. COVID-19 has pushed us to just a real challenge ahead on, and that we cannot afford to wait any longer in taking necessary steps to help make our health community stronger through the use of coordinated and responsible digital connectivity. Next slide. At Niagara Health, we believe that starting down the path of enabling patient-centered care through Niagara Health Navigator program, we have helped build momentum towards something beneficial to the larger Ontario community. As mentioned earlier, we have benefited from leadership of various ministries throughout the province. And in light of implications of how the Niagara Health Navigator program will help the perspective, I would like to invite and introduce Rob DeVries for the next part of our presentation.
Thanks, Shane. So good afternoon, everyone. I'm Rob DeVries, Assistant Deputy Minister with Ontario Digital Service. We have an important role to play within the Ontario government as it pertains to delivering digital identity. I want to talk a little bit about the opportunity that this work with Niagara Health, Ontario Health, and the Ministry of Health presented to us in terms of advancing our digital identity agenda. We are the lead organization within the Ontario government for the promotion of digital identity and creating a unified approach and strategy. It's easy to imagine getting disconnected with all the various different parts of government trying to solve for the same problem, which is the same problem that we're all trying to solve for. How do you prove who you are and assert facts about yourself in a digital way that can be authenticated and verified by a trusted source? And so the Ontario government, in its role as the issuer of some of the most important foundational evidences of identity, your birth certificate, secondary sources of identity like your driver's license and your health card, obviously has a role to play as an anchor in the identity ecosystem. And so, we often talk about three main foundations and pillars to our digital identity approach, and they are building a foundation of policy and technology. They are engaging the marketplace, because we do believe this is an ecosystem that spans the private and public sector, and delivering value. We don't want to wait to deliver value until we have all of the key enablers in place. We want to do this in an iterative way. Nobody knows where the destination is on this digital identity journey that we're all on. And we can't wait till we have it all figured out before we start to take the first steps. We actually need to start to take those steps to help advance the conversation and the technology. And so what this allowed us to do is really test all three of those things. Build the foundation, which is really our hypothesis that that government as an identity issuer needs to figure out the policies and the technology to actually give people an opportunity to assert facts about themselves that are held in trust by government, so that they can actually start to use that information in a digital way, in a privacy enhancing way, in a way that's actually going to make things more secure for them. The second is the market. You know, this was an opportunity to partner with the Ministry of Health, Ontario Health, Niagara, but also the partners that Niagara brought to the table, Security and IdentityNORTH, to start to see how all of these parts fit together and really advance the work that we're doing on the Pan-Canadian Trust Framework. This will be, I think, the first opportunity for us to start to test that conformance criteria across three elements of the public sector, the broader public sector, and the private sector. And so we really look forward to bringing that element and advancing the evolution of the Pan-Canadian Trust Framework. And thirdly, the digital first approach, which we champion within the Ontario Digital Service. We have a number of approaches that we take when we work with partners. And one of those is a digital first assessment to make sure that as a government, when we're delivering new services, we're doing it in a digital way. We're following our digital service standards and we're following those principles. And so bringing those out to the broader public sector and being able to work with Niagara Health and our private sector partners is a real opportunity to take that digital first approach outside the walls of government and start to apply it in new and different circumstances. And through that, we believe that we build small solutions and we iterate, and that is the digital way. It's a method of discovery, and it's how we get better, it's how we learn, and we really believe this gives the opportunity to do that. And then finally, you know, we deliver value. And so we're building the foundation. We're working with ecosystem partners and we're delivering value, and we're doing that all at the same time. We're not waiting for one piece to be done before we go to the next. And we believe that no matter where digital identity goes and all the great conversations we're having around the table over these last couple of days, the foundation is going to be anchored in government evidences of identity and how we make those available to work for people. So this project is an exciting opportunity for us to kind of test all of those things and advance the yardstick as we're still working on our strategy and having those conversations with government. So really excited to be there and pass it off to, I think I'm passing it off to Greg?
Joe.
Or Joe.
Yeah, no problem. Hi, thanks, Rob. So good afternoon, everyone. My name is Joe Mayer, and I'm CRO at IdentityNORTH. And as everyone here, I think, is excited about this program, we are as well. We're really proud to be part of it. And I want to talk a little bit about the benefit. Why are we doing this, right? So the program is designed to meet the demands of the call that was put out by the Ministry of Health. It was clear in that call that we needed a win-win-win across a number of stakeholders that would ensure primarily that patients, but also the health authorities and the province themselves could benefit and realize the benefits to a common approach for access management. The fourth win, though, that's really important is the ability to work directly with ministries across sector to support the broader identity goals of the province. And not on this slide, but important to call out as well, is that there's clearly a fifth win. And this will resonate, I think, with this community, that it's the digital services, it's the innovators like CamImmunize as an example, that have a clear path now to access patients and actually use the data to provide their respective services and bring value to the end patient. Even health providers as well, but patients primarily is the focus here. Next slide, please. So Greg, I'm gonna actually have you start off on this one and then I'll jump back in.
Yeah, sure. So Greg Wolfond of Security. So there's two problems with this that everyone's on. Like, health is the holy grail. People want to be able to manage their health, and the teams here are doing a great job. But to do that, we also want to make sure that their privacy is respected. We want to make sure there's a level of security that's high enough to let the access to health records happen. And that's why it takes so many of us working together to kind of get this right. Part on the identity assurance side is, if we can tell from government, as Rob talks about, we have a source document and this is really Greg's health card. But in addition to that, because that's easily copied, if we could also check other factors, like can he log into his bank and have his bank say, this is Greg? We know that something up to 20 million Canadians log into the government using their bank things. So it's a very frequently used, easy to use thing. And if we can check their phone, is it coming from their phone? And then with privacy, so no one of those parties can track the user, then we've got a great way to do identity validation with multi-factors. And we have a way to enable them to get over to the health side, which comes over to your side here, this access control, Joe.
Mm-hmm. And so with the emergence of PCTF and the alignment that this can bring around governance, we look to enable this technology that combines to remove even more friction for a user, right? So allowing the user to leverage existing digital identities that are already in their life or create a new one if the circumstances require, but linking that to the foundational trust of the data and the services that need it most, right? And do that with privacy, respect, consent, and control in the user's hands. This, again, it goes back to the innovators. This will drive that low friction approach to bringing more adoption for patients. And so what has happened here? The program at Niagara that Sheem touched on very well in the beginning has expanded, right? It's really about building on that success that Niagara decided they wanted to make this investment and bring this to the broader needs of more than one health community. So we've established a collaborative governance structure across 4 hospitals that allow those hospitals or those health regions to actually still respect their local community needs, but work in collaboration with ODS, Ministry of Health, Ontario Health at the governance table to ensure that the policy and the framework at large around how this scales out is actually being dealt with as in parallel to the technology implementation and the user benefit. So the architecture, last comment on here, it allows for a hub and spoke approach, but we're actually not using a single instance. We're distributing this in a federated model to prove out that interoperability across regions as well. And this is really important to prove out that larger scale opportunity. Next slide, please.
Yeah, so this is now coming back to a sample kind of user journey and all of this stuff. I'm showing up to prove who I am. So you wouldn't do this every time you come into health. You probably use your Face ID on your phone when you're going to the gateway, or you use other kind of login mechanisms that you have. But to prove who you are the first time, what's an easy way of doing that, right? So in this example, I can choose one of my financial institutions. I can log in, for example, at Royal Bank. I can enter the out-of-band code that came to my phone. So I'm checking that I know my password to Royal Bank and that I have Greg Wolfond's phone. And when I say it's okay, it asks, am I willing to share this information? So I'm trying to share that it's really Greg Wolfond with this date of birth and is authenticated now, which steps us up pretty seamless. Like most people who do anything online do their banking online as well, especially these days. The next part is then let's validate my card. So it could be here where I'm typing in my, some of it pre-fills, but I type in my card number, my health card number, and then we're able to check against the gateway that Ontario set up to make sure, is this health card really Greg Wolfond's health card, or in this case, Madison's health card, able to validate that it's good and in good standing. And the combination of, hey, has the health card and is able to log in at the bank and has the phone makes this super strong at the registration step. I want to point out, this is also usable for recovery. So if I forget I switch to a new phone or I forget my password to log in, I want to recover, we have the tools now to let that user recover to get back into their account and not lose anything. But whether I'm entering my card details or I'm taking a picture of the front, back, and a liveness test around it, you still need other factors to make it secure for an individual coming through. And so we're trying to demonstrate the use case of, hey, I just had to log into my bank, enter my health card information, and boom, I'm into the system.
So the interoperability is a key project goal that we've touched on a few times, right? And the result of the alignment to PCTF and the establishment of identity assurance, authorization, consent, in this framework, our partners can work together to share value and reduce duplicate effort. And again, back to the collaborative governance structure, it allows the local hospitals or health regions to be nimble with their own regions, but benefit from the cumulative gains across the program. What works in one region can be proven and then brought to another region at very low friction and very low cost. And next slide. So we have really touched on, this is really our closing out slide, touched on a repeatable user journey. And we want to highlight that this is about bringing together the best of a number of vendors and a number of partners to make it repeatable for a user so that the citizen can remove friction depending on their own care needs. So they can still trust and access their local healthcare providers and that trusted brand, but in a consistent way that allows them to discover and access the services that matter to them. And Greg, over to you for the closeout.
Yeah, so this is like, it seemed fairly straightforward as we run through this, but you know, the work that's gone on by the Ministry of Health, by Ontario Health, to get all this stuff and figure out what are the standards and how do we in Ontario conform to PCTF and make sure the citizens are safe. The work that's been done by Niagara to put it together, the work that's been done by IdentityNORTH to build a platform that makes it easy to come across. It takes a lot of parties working together to get this done and get it right. And I like Rob's approach that said incremental steps, let's get it right and keep refining and keep refining. But this is what citizens need, you know, especially in this time of COVID, people are not coming into hospitals, showing a health card number, getting a PIN, and going home with that stuff. So how do we make it easier for people to book their appointments, get things done? And I love the work that Niagara is doing, that Sheena's doing with Niagara. I love what Ontario is doing, opening up the gateway. I love what IdentityNORTH is doing. And I think this is going to be a great showplace of how things come together and make it easy for citizens and safe for citizens to access the services they need. So I couldn't thank everybody participating enough for being part of this. We're thrilled to be a small part of it. And thanks to all of you for participating.